Are you concerned about what might increase your blood pressure? There are quite a few things that can factor into raising your blood pressure. Luckily, you can fix many of these with a few lifestyle changes. If you do not watch your blood pressure frequently, you might not even be aware that you have it. It can creep up on you or just increase over the years. It all depends on many different factors. If you are overweight, you are at an increased risk of developing high blood pressure. You might already know this and you might not. If this is the case for you, consult your doctor and see what he might recommend for you. Losing at least 10 pounds can significantly lower your blood pressure. An unhealthy diet or lack of physical activity or exercise can also put you at risk for high blood pressure. Try to exercise at least 30 minutes a day even if you have to space the time out. Eating less salt and more vegetables and fruits can help lower your blood pressure as well. Try to incorporate this into your present diet and you will see the results rather quickly. Stress plays a huge factor in high blood pressure, and unfortunately everyone is stressed at some point in their lives. If you deal with a high amount of stress, consider relaxation techniques. Do whatever you can that you know will calm you down and help relieve stress. Using tobacco and alcohol raise your blood pressure. If you use either of these, consider quitting. If you are unable to quit right away, limit your consumption of alcohol and use of tobacco. There are many over-the-counter and prescription products to help rid yourself of these habits. Talk with your doctor of any concerns you might have. Medical conditions also factor into high blood pressure along with your lifestyle. Kidney disease can result in high blood pressure as well as cause it. Sleeping disorders that interrupt your breathing during sleep will also raise your blood pressure. Talking with your doctor about your condition could benefit your disorder along with your blood pressure. Certain medications and drugs can also raise your blood pressure. Certain types of antidepressants will do this as well as certain cold medicines. Be aware of oral contraceptives, nasal decongestants, anorexia drugs and steroids. These can possibly raise your blood pressure as well, so talk with your doctor before taking any of them if you are concerned. While you can control most of the factors that raise your blood pressure, there are some you cannot. For instance, your race. African Americans are more prone to high blood pressure, people over 55 are at a higher risk, and your family history can play a role in your blood pressure as well. While you cannot control these factors, you can easily try to help decrease your risk. Watch your diet, exercise, lifestyle habits, etc. Over time, this may be very beneficial to you. High blood pressure can cause strokes and even heart and kidney diseases. Leading a healthier lifestyle can help you live longer and enjoy your time in a healthy state. Talk with your doctor about any questions or concerns you may have concerning your blood pressure. It is never too late to take control. What should you know if you have high blood pressure? If you are battling high blood pressure, there are some things you will want to know. First thing you want to understand is what the numbers mean. Your blood pressure will read with a top and bottom number. The top is your systolic pressure and the bottom number is your diastolic pressure. Normal blood pressure is 120/80ths, so if your blood pressure reads 130/90ths, you are at risk for developing high blood pressure. This reading is called prehypertension, which is basically a stage before developing high blood pressure. By having your blood pressure checked and monitored often, you can easily lower it where it needs to be. The best way to do this is by maintaining or adopting a healthier lifestyle. Have you always had normal blood pressure until recently? If this is the case, consider what you have recently started doing different that may have caused it to rise. Did you change your diet? Have you been exercising less? Maybe you are on a medication. Some medications can cause your blood pressure to rise. If you do have high blood pressure, you can easily monitor it at home if you choose. If you do this, you still want to keep your regular doctor visits. You can share your own results and you can both see what is and isn't working for you. If you are on other medications, consult your doctor. Chances are one of these could be raising your blood pressure and you want to take control as soon as possible. If your blood pressure gets too high without proper treatment, you are at more risk of having a stroke or heart and kidney diseases. If you have recently changed your diet, you should talk to your doctor, especially if your blood pressure has risen since then. Lots of salt and sodium can cause high blood pressure and not enough fresh fruits and vegetables. If this is the case, try to limit your salt intake and get more vegetables in your diet. Also, physical inactivity can be a cause for high blood pressure. Have you recently stopped doing regular everyday physical activity? If so, consider starting again. You might have stopped because of an inevitable reason, broken bone, etc. If this is the case, talk with your physician. Together you can find a way to still get a little bit of physical activity in your daily routine. You also want to cut off or limit your use of tobacco and alcohol consumption. Many people do not realize these cause high blood pressure. There are many over-the-counter medicines and even doctor-prescribed medicines to help you quit smoking. There are also many different resources to help you quit drinking. If your doctor prescribes blood pressure medicine for you, you want to be sure and remember to take it. Some people are bad at remembering to take medication. There are many different ways you can help yourself remember. You take the risk of a stroke or heart disease by not taking your blood pressure medication. This should be reason enough to take your medicine, but sometimes people just forget. While it sounds like reason enough, if you are not used to taking daily medication, it is rather easy to forget. If you have certain questions or concerns, talk with your doctor. They will gladly answer any questions you have and do their best to get your blood pressure at a normal rate again.